I'm talking about anatomic structure and physiologic function. I'm saying that anatomy is the study of human structure, physiology is the study of human functions, and that's why we relate it anatomy and physiology. So think about it as structure and function. So what you are studying is simply structure and function.
Real quick, is that Tertiary?
Yes.
Okay.
It's just my very professional way of writing, like a medical doctor, right? All right. Now, so now the reason I went to protein is to tell you that structure determines function. No structure, no function. And I was telling you, so which of these proteins are functional? No. No.
What was your question?
The question is this: which of these proteins are functional proteins?
Number 4.
Why?
Well, they already said a couple of them.
All right. If you want to look it up, I don't mind. Look it up. Like I told you.
Elimination.
It just means smart. Elimination, right? Very good. Now, you forgot that they've only eliminated one. Somebody said all 4. Someone said primary. That's all I've gotten. So you said quaternary now, right?
Yeah.
All right. So look up the answer. Tell me. Look it up online. When I teach, if I ask you questions and you don't know, look it up. If it's not right, I'll tell you. If it is right, I'll tell you. Now, which of these proteins are functional or is functional? Google is taking time. When I say look it up, I wish that everybody looks it up.
Tertiary structure.
All right.
Large molecules. That one? That was your... There you go.
Is that what you saw?
Yeah.
All right. Who else saw something else? Which one is functional? Tell me your name.
Matt.
All right. So you said this is functional. Who else? Now, don't be scared to see what you saw on Google. You are not the one, it's not your answer, so you are not going to be wrong. Just say what you saw. Which structure of protein is functional? Simple. What's the answer?
Well, I would go number 3 or number 4.
All right. Answer is actually these proteins are functional.
Okay.
Now, this is non-functional, this is not functional. Now, this is a linear protein. It's a combination of amino acid that joins together. So we call this a peptide or polypeptide chain. It's a polypeptide chain. It is non-functional. Now, this is going to form this is going to give you you will see like alpha helix or beta sheet. It is also non-functional. And the reason they are non-functional is that proteins are only functional when they have a 3-dimensional shape. When they are folded. Did you see anything like that when you were looking it up?
Yeah.
Proteins are only functional. Very good. When they are folded, when they are twisted and coiled together. So now you remember your hemoglobin. It has, go ahead.
You said the second one, that's what it creates, the alpha and the beta?
Yeah, alpha and beta sheet. That's it. Those are the examples of the second one. You can look it up too. Now, they are non-functional. And I told you now that it is at this point that they coil, they are folded and twisted to form a 3-dimensional shape. It is when they have a 3D shape that they are functional. Now, this is just a simple analogy, like a conversation between us. They are not functional. Proteins are only functional when they have 3-dimensional shape. Did you remember hemoglobin? Hemoglobin. All right. Now, hemoglobin. Everybody in this class have hemoglobin. It is what?
Okay, so what does a non-functional protein do for your body?
Now, it is a process.
Oh, it's a process. Okay.
This
okay,
is the
okay,
first
okay.
stage, this is the second stage, this is the second stage.
Alright.
This,
Got
a
it.
couple of these glue together to form this. So
Okay.
it goes like that.
So it's just making it function.
Exactly. We'll still deal with biomolecules and I may talk a little more about it when we get there.
Okay.
Now, so hemoglobin it's a tetramer. Tetramer because it has 4 subunits. So think about it this way. It's like something that have 4 subunits, 4 units. And if you look up the shape of hemoglobin, you will see how it looks. That's what your red blood cells bind to that carry oxygen, right? That's what carries oxygen. That's what, if there is a mutation on it, it leads to sickle cell, right? That is hemoglobin. Now, these have that shape. Anything that happens that alters the shape affects the process. So in your body, you have these proteins that are functional proteins. If your temperature rises beyond up to 104, that's fever, right? Right? And what do they tell you to do when temperature rises up to 104 or above 104? What did they ask you to do? What do you do? Okay. You call the emergency, right? Or you run to the emergency once temperature rises beyond 104. Why?
Your brain starts to cook. Start cooking yourself.
All right.
Too hot.
The reason is this. Every activity you do in your body is performed by proteins. So once temperature rises beyond 104, the temperature breaks the bonds that join these proteins together.
Oh, that's interesting.
So the proteins begin to lose their shape and become either straight or they become all of these because they were broken up now because it's a couple of smaller proteins before. So when temperature rises, high temperature is going to break those bonds and the protein will lose their shape. Once they lose their shape, if you did biology a little now, you could have heard of this. If you have not heard of it, it's not a problem. If you have not heard of it, no problem. What is going to happen is this. This is denaturation. And what happens, this is what happens to protein when temperature rises. Now, protein will lose nature. You remember, this is D. It means to deactivate, right? So it will lose its nature. And that's why they tell you that if anything happens and your temperature rises beyond 104, run to the hospital because that affects the whole system can shut down because protein will not be able to work. Protein is what performs all the functions in your body. Metabolism is protein. The only thing that ATP does, carbohydrate does, is to supply the energy. So protein is actually the guy there, is the master guy, not just carbohydrate. Carbohydrate is highly pronounced. You say you don't have carbohydrate, you need energy. But if you have energy, if you have gas and you don't have a car, nothing happens. You can't come here with gas, right? You need a car. So protein is the car in your body. ATP is the gas. Carbohydrate is the gas. All right, let's go. So now the reason I went there is deliberate because if there's no function, no structure, there's no function. Prostate cancer is usually common when for people between the age 30, 35 upward, right? For men. Now, what is the reason? The only thing that happens is that as you grow old as a man, the prostate gets to increase. It has tendency of increasing in size. And that predisposes people to either cancers or all of those prostate challenge because the size is increasing. So shape affects function. Think about it. Your heart is inside the thoracic cage. If the heart just decides to grow larger, what's going to happen? It affects the function. As little as your finger, if it gets swollen, what happens? It pains you. So structure and function are together. If your eye gets swollen today, even if you can still see, you will tell me, Mr. A, I can't come to class because my eyes are swollen. Function, structure determines function. All right? Now let's go. All right. gross anatomy, there are some ways we study anatomy, and so now when we say anatomy is the structure, we focus on that a little. We talk about physiology a little. We talk about homeostasis, and I'll be thinking of letting you go home, okay? Now, gross anatomy is, from the word gross, what does it mean? Don't think about it's
As a
gross.
whole.
Very
Gross
good.
as a whole.
It's macro, right? It's big, right? So gross anatomy is the way, is when you study the body, studying what you can see, all right? What you can see, that's gross anatomy. So if I say I just want to study you now, I'm looking at your head, right? Looking at your hand, those are the things I can see. So I can say I'm studying your head, your upper limb, this is your upper limb, your lower limb are your legs, your lower limb. I can say I want to study the trunk, the thorax, the abdomen. That's what I can see. So we can do regional anatomy. We can study the gross anatomy using regional, studying through the regions. And that will be, I want to look at the abdomen. I want to look at the head and neck. Those are regions of the body. I want to look at the thorax. Those are regions of the body. Thorax is this, right? Thoracic cavity. Then I can use system. Those are options to study gross anatomy. And system, that's what you did today, right? That's what you did on your quiz. Systemic anatomy. So I can study the cardiovascular system. And cardiovascular system means it's cardio and vascular, heart and vessels, right? Cardiovascular. I can study the lymphatic system. I can study the immune system. I can study the reproductive system, the respiratory system. I can study the digestive system, the urinary system, the endocrine system. I can study all of that. Those are systems. Surface anatomy is just to say I want to study the surface of the body, right? Just the surface. You just look at the surface and you're studying the surface. That's surface anatomy. Then microscopic anatomy is simply the opposite of gross anatomy or macroscopic anatomy, right? Don't forget, gross and macroscopic are the same, right? Macro is big, gross is also big, all right? I hope nobody is thinking of it is gross, like, oh, this is gross. No, that's not the gross. It's the gross that is big. All right. The micro is tiny, so you can't see it with your physical eyes, right? You have to study it with the aid of microscope. So microscopic anatomy, you have to use the microscope to study it. And that's part of what we're going to do in the lab today. I'll be asking you to look at the areolar tissues. You'll be looking at a slide, just a tiny slide. And how do we make those slides? We take a tissue, slice the tissue in a very tiny manner, and we put it on the slide. The slide is a tiny glass, which you are going to see in the lab. Then we put stains on it. The reason we stain it is so that we can differentiate the colors, because everything will be colorless normally. So we stain it so that you can differentiate the colors when you are looking at it on the microscope. And you look at it, that is microscopic anatomy. You are looking at the whole tissue, but a sectional unit of it that has been sliced and stained. So you'll be seeing that in the lab. Sometimes you see pink color, you see purple, because of the stain that has been, the tissue that has been stained with. So histology is tissue. Then from the word cytology is the cell. So that's what you do when you do pap smear. Ladies there should know pap smear, right? Guys, do you know pap smear? You can, all the guys are serious. You don't know what it means. All right, this is everybody. Sometimes you could have had times when they had to check the fluid or the fluid in your hair. Have you ever had anything like that? Sometimes when you had hair secretion, then they had to take your hair wax.
Do what?
Maybe you have some secretions in your hair, or hair is paining someone. They take the hair wax, put it on the slide, analyze the slide, analyze the cell, and come up with results to tell you what is wrong with the hair. Sometimes you have a cyst. If somebody has a cyst, you know what a cyst is, right? Mm-hmm. It's a fluid field. Okay, so you have that. They take some liquid from the cyst. The cyst I'm talking about is CYST, right?
Yes.
So they take some liquid from the cyst, prepare a smear with it. A smear with it, and it is cytology. They look at the cell, that we analyze it, and it tells what is it. So something like that is also pap smear. They use it to check for tendency for cervical cancer, for pap smear. Okay? So that's what it's called pap smear. So anytime you are taking tiny stuff. Sometimes in biology you do some experiments for Bio 1. For some of you that would have taken Bio 1, You do some experiment, they ask you to use toothpick to take some cells in your cheek. Whoever did that? You did it pre-COVID, right? Before COVID. And so when you do one, sometimes they ask you to just use toothpick to scratch some cell from your cheek. If you just put it inside and scratch some, then you analyze it in the lab and you can see what is it. Those are cytology. Now, cytology is just analysis of the cell. You know you are not taking tissue at that time. Did they ask you to cut your cheek?
No.
Okay. So, if you have to cut your cheek, you are taking tissue. But if you are just scratching something, that is cell, right? So, that is cytology. Now, developmental anatomy is just study of structural changes that happens with the body. Then we do radiographic anatomy and pathological anatomy. Radiography is study of bony structures. People do radiography, right? Radiographer, sonographers, all of that. Then pathology is the study of structural changes that happens. Now, pathology is study of structural changes. I talked about prostate cancer the other time, right? So if I want to check the pathology of prostate cancer, and one thing I can be looking at is the enlargement of prostate cancer. That's a pathology because the change that happens to it. Does that make sense? Good. So anytime you are studying an organ in biology, we also talk about the pathology or clinical correlates. When you say pathology or clinical correlate or clinical relevance, we are saying what are the diseases that can happen to this organ. All right? So sometimes you do that. For people going to medical school, nursing school, you do that. We just look at all of those. Now, neurophysiology, from the word neuro, what comes to your mind? Very good. My friend is doing like this. Yeah, neuro. Say, is your neuro side correct? Yeah. So neurophysiology. Now, what does that mean? From the word physiology, neuro and physiology, what does it mean? Neuro is
brain
function, right? So function of the brain, of the nervous system. When you talk of nervous system, you know you are talking of what? When you talk of nervous system, what are the two organs there? The brain and Mr. A? The brain and the spinal cord, right? Good. So we have endocrinology too. Endocrinology is study of the endocrine system, right? And when you talk about endocrine system, what are you talking about? Tell me. Hormones. Simple. It's hormones. And obviously, you know that most of the hormones in your body are proteins. A good number of your hormones. Most of them are proteins. So you can see how protein is. So next time you see protein, what do? You respect protein, right? Because most of the activities that is done in your body is performed by proteins. Carbohydrate is what we esteem normally, right? Mm-hmm. Say you want to take sugar, you feel like, I'm fainting, I want sugar. Yes, but it is protein that does most of the function. So anytime you see protein, what do? You respect. Now, cardiovascular physiology, from the word cardio, right? What is cardio? Heart. What is vascular? Blood vessels, right? So it's a study of the function of the heart, blood vessels, and the blood. Then immunology, which is what Mr. Hill likes most, right? And what is that? It's the study of the immune system, how the body defends itself. Good, let's go. Now we have respiratory physiology, which is study of the function of the lungs. Now this is the reason I came up with the quiz, which I may still do something like that, is this. Once you know those systems, and you know the organs in those systems, then you know the function, you've known a lot of things. Because even when we say respiratory system now, respiratory physiology, once you hear respiratory, the organ that should come to your mind is the lungs, right? So if you can know all of that, you will know a bunch of things. So I'm still most likely going to give you another quiz on that. Maybe. Renal physiology, obviously, when you hear renal, what should come to your mind too? Kidney. Good. Then when you hear exercise physiology, what should come to your mind? Exercise. I'm just kidding. Then pathophysiology. Now, pathophysiology. What did I tell you is pathology the right time? What is pathology? Pathology is good. It's the study of disease, right? When I say pathology of an organ, you are checking what are the disease that can happen to the organ, right? So pathology. So when we say pathophysiology, what are we looking at now? the function now changes. So when I was talking in anatomy, it's the structural changes that happens to an organ, right? But in physiology now, it's going to be functional changes that happens with an organ. Then reproductive, obviously, is the study of the reproductive system. All right. Now, organization of human body. Organization of human body. Every living thing exists in the, or let me say every living thing is, one of the characteristics of every living thing is organization. And when we say organization, think about it from the word organism. Now, no organism exists without having a cell, right? The functional unit of every living organism is cell, right? Then every cell have an atom, right? Every cell have an atom, form molecule, form a cell. From atom, molecule, then you have cell, then you have tissues, you have organ system, you have organism, then it continues. So that is so you should just look at that. No, two atoms comes together to form a molecule. Hydrogen plus hydrogen gives you H2. Oxygen plus oxygen gives you oxygen O2 molecule. Then you have cells, which you can have your smooth muscle cells, you can have your cardiac cells, right? You can have skeletal cells, you can have your eye cell, all of those cells. Then muscles, you can have smooth muscles, cardiac muscle, nerve. You can have the other one is what's the last one? Or I'll still give you an acronym for system. So this I call it semen. You have the cardiac, you have the muscle, you have the no, sorry, I'm missing not. There's something I want to explain.
You said cardia.
Wait. What stage was I? I was talking about tissues, right? So you have cardiac, you have muscle, you have epithelial. Then you have nerve. I'll just call it nerve. So I call it semen.
What's the E?
Yeah, what is that?
I can't see where.
Yeah. E-P-E-K? What?
Sorry, I think I missed something. I was talking about. This is not acronym I use for. I was talking about tissues, not muscle there. Sorry, but then I will still give you this now. Sorry about that. It's okay. Wait, don't cancel it yet. See what I want to write. This is tissues, not muscles. All right. So tissues. This is connective tissues. I was mixing it up to use it for muscles. This is muscular. This is epithelial. And this is nervous. So that's my acronym for tissues. So I just call it semen. So when you hear semen as a man, you think about semen. But this is semen. All right? It's my acronym for tissues. Make sense?
Yes.
All right. Sorry about the confusion. Now, so organism of life is that every living organism has those existence up to the organismal level. So let's go. I'll be talking more about that. All right. Now, systems. Now, I have a very interesting way of learning systems. And you can't forget again, okay? Do you want to forget after I teach you now? After I teach you now, you can't forget again, okay? Or do you want to forget?
No.
All right. So, can I clean this up?
Yes.
Good. I want to show you how to remember all the 12 tissues, all the 12 organ systems that we have. Maybe this is better than 12 organ systems, how to remember them. So my acronym is this. It's red, monks, film. You may say it's not interesting, but it's interesting. You just know. Now, red monks film. It's like red monkey film, but we just abbreviate the monkey. So it's red monks film. And what is that? This is respiratory. I'm going to write it normally. So red monks film, the red is respiratory, endocrine, digestive. The monks is muscular, urinary, nervous, cardiovascular, skeletal. Then we have the female reproductive, the integumentary, the lymphatic, and the male reproductive. Now, do you think, I know these things, but do you think I can't mix it up and forget one of them at any point? I can, but I cannot forget because of this. If I'm just to make a list, I can make the list and forget the one I've not written. Do you get what I'm saying? Even though I know it, but I'm not going to forget with this. So red monks film, red monks film. That's the acronym for it. All right. Now, the first one is integumentary. And what you have in there, I may not go too far. I may just look at few things and let you study some because of time. All right. So major things you notice that, note the organs. So I won't go over the organs, the systems, okay? Major thing I need you to know, but you must know is, major thing I need to know is the organs on there and their functions, okay? I can skip that, right? Since I already gave you the, yeah. So just know the organs on there and the functions of each of the system. And I have it here. I just updated the PowerPoint, so you see the PowerPoint on Blackboard as well. All right, characteristics of living organism. So when you say living organism, it must have major characteristics, which is metabolism, responsiveness. You should respond to stimulus if you are a living organism, right? You should be able to move, you should be able to move, you should be able to grow, differentiation, reproduction. I'm just going to move past those. Now, what is metabolism? You remember the other time, Maze, right? Tell me your name again.
Matt?
Tell me your name.
Matt.
M-A-T-T. M-A-T-T. All right. Now, Mark the other time told me that he asked me when we talked about primary, secondary, tertiary, and quaternary protein. And I said the functional ones are tertiary protein, right? And quaternary. Then he said, what is the function of those two, the primary and the secondary? And think about it. What are the functions? The function of those two is to help in building up the tertiary and the quaternary, right? But how do they help? The process of building up large molecules that you need in your body we call it anabolism. Now you heat some stuff, your body break it down to make what it needs. So whenever you are making larger complex, we call it anabolism. Then sometimes you heat some stuff, your body break it down to what it needs. Anytime your body is breaking it down, it's catabolism. But the whole process, catabolism and anabolism, is all called metabolism. And what organ in your body perform metabolism? The thyroid gland.
The what?
The thyroid. The thyroid gland.
What
Yeah.
is the thyroid gland?
Thyroid gland.
Thyroid.
Oh, thyroid.
Yeah.
Okay.
The thyroid gland is what perform those actions. And so, you know, sometimes, have you ever heard of hyperthyroidism? Okay. Hyperthyroidism. It's simple. They put hyper, meaning that it is high, thyroid, the organ, and ism to make it sound good. So, hyperthyroidism. What does that mean? Your body is hyper, then hypo, right? Hypo is the opposite. Hypo is low, thyroid is the organ, ism to make it sound good.
Hypoglycerin. Okay, like hypoglycerin, that stuff.
Yeah.
Okay, okay.
So hyperthyroidism simply means that your body is producing, is converting your food too much to ATP faster than normal or without control. It should be converting it and be producing it when it's needful. But the moment you heat, if your body produce everything, convert everything into ATP, then you have no energy again. You still want to heat again. So those people heat more, yet growing lean, right? Those are people with hyperthyroidism. Hypothyroidism, they heat, but their body does not convert it enough. It's slow. The conversion is slow. All right, so what we call metabolism is anabolism and catabolism. Anabolism, add. Anabolism, adding, bolism. Catabolism, cut. Catabolism. So catabolism is breaking it down. Anabolism is building it up. Differentiation and growth. Now, differentiation and growth is simply that when you think about, it's a lot of process and I won't go to it because of time. Differentiation is simply this: egg and sperm comes together, produce fertilization, right? The fertilization. Then it gives rise to a zygote, right? When the zygote is formed, it's just a one cell because the egg is half cell, sperm is half cell, coupled together to form a single cell. Then it keeps dividing. That's why you don't give birth to a child the day fertilization is done. It has to wait 9 months to keep dividing, go through different process. The process of dividing to yield another, dividing to yield more, is what we call differentiation. It has a lot of process. We have cleavage, all of that in between, gastrulation, but you don't need that now. But that's that. Now, when a cell divides and it's dividing again, I think I may still have to go through mitosis with you sometimes, but that is called mitotic division. The division that your cell go through to grow is mitosis. The division that your cell go through to produce sperm cell or egg cell is meiosis. So mitosis, the major function of mitosis is growth. That is what you use when you have injury. If you have injury, you have fracture, and it has to heal up. It's mitosis. But the only time you need meiosis, is for fertilization, just to produce the egg or the sperm. All right? Those are the only function of mitosis. Now, let's go. Okay, good. I'm on a good pace. This is 7:13, right? Now, homeostasis, I've talked about homeostasis briefly, and it's simply to regulate your body system. Is it hot in here?
Yeah.
Good. Good. How do you know that it's hot? What do you say?
Because it's hot. Your back's sweating.
Very good. That's what I want to hear.
Yeah.
Because you are sweating, right? Now, why are you sweating?
AC. They forgot to pay their
Somebody
bill.
said something. Because
Your body.
Regulate your temperature.
your body is trying to regulate the temperature.
Yeah.
Now, it is hot. So what your body does is this, but the body, your hypothalamus senses that it's hot inside as well because of the heat outside, right? Then what your body does is this. It sends a lot of blood vessels. It says blood should now be sent to the sweat gland so that it can release some heat that is already accumulating inside. Because if sweat gland does not receive some blood, it won't be able to release the heat inside. You say, okay, sweat gland should get some blood now so that it can release the heat inside to the outside. And that's why you are sweating. And you are sweating out. That's why you notice that normally, as the first time you are sweating, it will look a little hot too, because you are sweating out the heat inside. All right? So that is homeostasis. The same way when you heat sugar, your pancreas releases insulin, digest it, your blood sugar is normal. The same concept you use at home. You set your temperature, your thermostat to 75. Either the outside is 90, 100, your house is never 100. Your house brings it up or brings it down whenever the temperature goes up. So that is homeostasis. Now, so the same thing happens to your pH value, your pH level. Your pH level must also be maintained at a particular level. Your temperature must be maintained at a particular level. Part of the three things that affect, one of the things that affect protein structure is also pH. So pH also affects protein structure. So pH has to be kept at normal. The normal pH for human is between 7.35 and 7.45. It must be normal. You don't want to forget that. I can remember to ask.
Okay, 735, 745.
So you didn't hear before. 7.35 to 7.45. All right. Now, these are the two systems in your body that control your pH. Did you remember the other time that I mentioned that your hypothalamus sends signal to that blood should be sent to the sweat gland? Did you remember? Hypothalamus, that is the nervous system, right? Then the endocrine system is the hormone. So two things. And you remember, I told you, most hormones in your body are proteins, right? So that tells you protein again. So hypothalamus and protein, those are the bosses. Hormones, right? So those are the two organs that perform homeostasis in your body. Now, this is very important. You should not forget this at all. Feedback mechanism, I'll be talking about it in a bit. And I will also talk about the component of feedback mechanism. Now, when we say feedback, we are only talking about how your body receives feedback. Now we talk about heat. It's hot now. I could feel more heat because I'm active, right? Because I'm walking around too. So my metabolism is higher than yourself that you are sitting. So I'm burning more calories than you. Okay? Good. Now, how do I know? How does my body know that something is happening in my system? Feedback. Now think of feedback just like feedback. You are giving a feedback, right? The hypothalamus is getting a feedback that, oh boy, it is hot here. You have to be careful. So then, even though I don't know actively how it's happening like now, but the hypothalamus works to regulate it. So the hypothalamus is the receptor. It's usually, no, sorry, don't go there. The hypothalamus is the one controlling the thing, right? Right? The hypothalamus is the one that say, now I got that it's heat, let me send something out. So the hypothalamus is usually the control center. But how do I know that I'm feeling hot?
Like, how do you personally know?
How do you know that you're feeling hot?
Well, you start sweating. You feel hot on your skin. You just
Very good. That's what I want to hear. So the receptor for that will be your skin. That senses the stimulus, right? Right?
Yeah.
That's the receptor. That's receptor. Then, what is going to be the effector for the heat?
The sweat.
The sweat gland can be. The muscles also can be, right? Because muscles also generate heat, right? Mm-hmm. So think about it that way. So something you want to play around is this. Go and look at blood sugar and be able to identify receptor, control center, and effector. Look at all of that, any of those mechanisms. Let me go now because of time. Now, positive feedback and negative feedback. There are two types of feedback. Now, don't think about anything. Positive and negative. Let me explain. Don't think about positive is good, negative is bad. No. Alright? It's not everything that is negative that is bad. Negative credit could be good, right? Positive credit might be bad. So it's not everything that is positive or negative that means bad and good. Now, negative feedback means this. If not for COVID now, I need an analogy. But we can't do that now. Even if I call you, you may be scared. Now this is. If you are matching your pedal when you are driving, your brake, is there a pressure that wants to pull it back to you? When you match your brake normally wants to come back, right?
Yeah, it does.
When you match it, it wants to come back. That is negative because it's opposite. So think about it. If I'm pushing something now and the thing is also pushing it back, it's turned back to me. That is negative feedback. So this door has its pressure, right? It's not staying. So I'm pushing it, it's coming back. I'm pushing it, it's coming back. I am doing something. This is against it. It's negative feedback. So any process that is antagonizing is negative. So when you talk about temperature goes up in your body and the hypothalamus work with the sweat gland to bring it down, that is negative feedback because it is opposite reactions. Make sense?
Yeah.
Your blood sugar goes up, the pancreas secretes insulin to bring it down. That is negative feedback because something is going up, something is bringing it back. Make sense? Your pH level goes up, bicarbonate bring it down, right? That is negative feedback. But positive feedback is this. Who has a baby here? I have one, but then my wife gave birth to the baby. All right. Now, you remember when you think who wants me to use her, for example? No, everybody that has raised up your hand, don't talk again. If I will give you my factors, then you will tell me if you want me to continue. You had contraction until you had your baby. And you want me to use it for example. All right, good, thank you. Now, when you began to have the contraction, between the time the contraction, did you remember when the contraction starts? Was it 38 weeks or? Can you remember?
Say that again?
Can you remember when the contraction starts heavily? Was it 38 weeks or 37 or 36 weeks?
It was 37.
So like 37 weeks, thank you. Did the contraction increase or decrease until you have the baby? Which one?
It increased.
It increases. Contraction will keep increasing until the baby comes. That is positive feedback. Now, what is responsible for the contraction is an hormone. The hormone is called oxytocin. The hormone is called oxytocin. What is happening is this. The oxytocin was secreted a little bit, then it caused contraction. So the first contraction you had was because the hormone was produced. So the hormone oxytocin was produced, she felt some contraction. The contraction will also tell the hypothalamus to secrete more oxytocin, not to stop oxytocin. Then, so look at this is contraction, this is oxytocin, then contraction increase. This contraction will tell hypothalamus again, secrete another oxytocin. The contraction will say secrete more. It will secrete more. The contraction will say secrete more. To secrete more. The contraction will say secrete more. That continues from 37 weeks until you had the baby on the 38 or 37, 39? 37, right? So the contraction increases until the baby eventually comes. It won't stop until the baby comes. Make sense? That is positive feedback. So the process, the result of the process intensifies the process. The contraction intensifies the secretion of the hormone. The contraction intensifies the secretion of the hormone. The contraction intensifies the secretion of the hormone. Does it make sense? That is positive feedback. I will use another example. It's still oxytocin. When your child is sucking, when you are breastfeeding the child, the baby lashes on the nipple, right? That once the baby does that, hypothalamus senses that the baby wants to suck, and it will release the hormone Oxytocin.
So oxytocin
Oxytocin.
controls both?
It controls both.
ends?
Yeah, it's the same hormone that controls both. So once the baby puts his mouth on the nipple and try to latch, then hypothalamus hears it that, oh, baby want to suck. It will release this hormone. The baby lashes again, hypothalamus release more. The baby lashes again, hypothalamus release more. That is why the way you start breastfeeding, you release milk a little the first day, it will keep increasing because hypothalamus is hearing the sound of the baby more. So oxytocin. So it's positive feedback. The result intensifies the process. The result intensifies the process. Are you enjoying the class? Are you bored?
No.
You want to sleep?
No.
You want to go home now?
Yes.
You don't want to go home. All right. But do you understand what I'm explaining?
Yes.
All right. Thank you. If you have questions, ask. Now, when there is imbalances or any deficiency to homeostasis, what is going to happen? The result can be disease or death. Who can tell me the likely disease that happens when blood sugar is not regulated properly? Diabetes. Why? Because it is going up and there's nothing that stops it. Which kind of feedback is failing there? Negative feedback. Thank you. Negative feedback is failing because it was going up. If blood sugar is now think about 98% of feedbacks in your body is negative feedback. Does that make sense?
You said how much?
About 98%.
98% is
About
negative.
98% is negative feedback.
Wow,
My
okay.
figures may not be 100% correct, but all I'm trying to tell you is that almost all feedbacks in your system, almost all homeostasis in your system is controlled by negative feedback. All right? Good. Then the other extreme that happens is if it's severe, death could happen. Now, body positions. This is not a problem. I will go through this a little. When you are erect, the position is this. This is standing erect. Then let me just go through this. Prone position is, now this is it. I'm going to write this. I wish that the way I'm spraying it, it should just be cleaning up.
Yeah.
That would be nice, right?
It would be.
All right. Now I'm talking about body positions: erect, supine, and pronation or prone. Now, there are three of them. What is this?
So,
Up, right? So that is facing up. All right? So once you know that, you know everything. Because sometimes all you need to know is one out of three. When you know one, you already know the others. This is clear. This is erect. You don't have problem with it, right? Erect is standing erect. Supine is when you are lying face up. That is the way doctors ask you to lie first normally when they want to examine you for anything. They ask you to lie face up. Your hands will be facing up. Your head faces up. Your toe is pointing straight too. Right? That is supine position. And from the word supine, you can see up there. Then pronation is the opposite of supine. Make sense? Good. Are we good?
Yes, we're good. Thank you.
Now, directional terms. All right, so I'll talk about these. This is simply straight, and anytime something is superior, it means above, right? Superior means it's above. So when I begin to join words together, don't be confused, particularly when we learn muscles, you will enjoy it seriously, okay? Now, superior means is above. Then think about this. Lateral means it is away from the medial. So when I say superior lateral, when I say superior lateral, it means it is above and it is away from the medial. Now, middle. Anything that is middle is medial. So something that is closer to the middle is medial. Something that is away from the middle is lateral. So medial and lateral are opposites, right? Inferior is below. Proximal means it is closer. So if I'm looking at my hand, you know this is actually your hand, right? You know this is not your hand. This is your hand. All right? Now this is your hand. Now your hand or my wrist is, so if I'm talking about my wrist and my ankle, I mean my elbow, which one is proximal to the shoulder?
Closer?
Proximal is closer, right? So the elbow is proximal to the shoulder and the wrist is distal to the shoulder. Does that make sense? Good. So when you say proximal and distal, it is relative. It is comparing it to something, right? So my knee joint is proximal to
your hip.
My hip.
Yeah.
But my ankle
Is distal.
So anytime you are talking about distal and proximal, it is considering from a point of origin.
Yeah.
Make sense?
Just like your fingers.
Good.
And your toes.
All right, so I've talked about that. Anterior, posterior. You know anterior, right? Anterior is this, right?
Mm-hmm.
Then posterior is the back. All right, good. Then ipsilateral, contralateral. Ipsilateral, contrary. Just think about lateral and contrary. Contralateral means it is opposite, it is contrary. Now, if you do a mid sagittal, this is middle sagittal. Sagittal means straight. Sagittal means straight, like vertical division, parallel division. So you can have mid sagittal, you can have parallel sagittal. Parallel sagittal just means it is parallel. But mid means it is equal, it is two sides. So it's a division that divides the body into two equal sides is mid sagittal, right? Now, when you do mid sagittal, there are some, let me draw Mr. A now. Then the other side is this. Is another Mr. A, not my Mr. A, okay? Now, let's say this is mid sagittal. All right? Anything that is on this side, we say it is ipsilateral. Ipsilateral structures will be your right hand and your right upper limb and your left lower limb. These two are ipsilateral, right? Because they are on the same side of the mid-sagittal division. Make sense? But if I'm talking about the upper limb, the right upper limb and the left upper limb, they will be contralateral because they are on two different sides. Make sense? Good. Plane and sections, imaginary chords that are used to study organs, that's plane. Sections are chords that are used to study body or organs. So just take note of that. All right. Now, when you talk about, I've talked about sagittal, right? Did you remember? Good. So I've talked about that. I'm just going to skip it. Then planes, you have frontal plane, sagittal planes. So frontal or coronary plane. Frontal divides the body into front and back, right? So this is going to be frontal cord, front and back. It divides it into anterior and posterior, okay? So frontal, anterior, and posterior. So you can think about it as fat or cap. Anything that makes you lean, that's fine. Frontal, anterior, and posterior, or corona, anterior, and posterior, right? Because frontal and corolla are the same. So it's either flap and cap. It is divided into anterior and posterior, front and back. Transverse or horizontal, right? Transverse, when you cut orange in in a transverse direction, it divides it into upper or lower. Then, this is actually key. All right, I'm almost rounding off. I have just 7 slides or 6 slides more. Now, but I'll be very fast. Please listen to this very well. This is key. We are not going to spend a lot of time in the lab, okay? It's just looking at 4 slides and you're done. So let's enjoy this and you'll be fine. Now, when you say cavity, what does it mean? When you say you have cavity in your teeth?
Yeah, what?
Cavities. Cavities.
In your teeth?
What does that mean?
Go to the dentist. Eating too much sugar, not brushing your teeth.
All right, when you hear cavities, what does it mean?
Decay?
It means yeah, decay. The decay is causing the hole. All right, it means there are holes. Cavities means holes. So you also have some cavities in your body. We have ventral cavity. The cavity, what they do is that's where some organs are, right? You know, the lung is inside a hole, right? A hole surrounded by bone, right? The lungs are there. That's a cavity. The heart is inside the cavity. That's a cavity, right? The reproductive organs are inside the cavity. That's a cavity, right? Good. They are all those organs. They are in the cavity to protect them, right? Because they are not supposed to be anything that is precious or that is delicate are supposed to be covered, right? So that is. So all organs inside the cavity, we call them. What's the name for organs inside the cavity? Tell me the answer. When I say tell me the answer, look for it anywhere and tell me. What is the general name for organs inside the cavity? It's my way of making you active to still learn, even though I'm teaching. Thank you. The name of organs inside cavity are called serous.
Okay.
Now, think about something. I'm going to go through the PowerPoint, but I want to teach this in a way that you can never forget it. All right? Now, the organs inside cavities, we call them serous. So what is an example of a serous now?
Like your lungs?
Thank you.
Heart.
Your lungs.
Everything inside your chest?
Everything inside your chest, right?
Yeah.
Good. Now, those are serous, right? Because any organ inside the cavity is a serous. Now, those organs, they have something that covers them, that protects them.
Like a film?
Thank you. So we call that membranes. So another thing we thought we can talk about is serous membrane. They protect the organ. Now, think about it again. Every organ inside the cavity also has a bone covering them, right? Those bone.
Bone marrow.
Now we are talking it's bone now. But I like the way we are thinking through it. Anyway. Now, so we have a serous membrane. So every of those organs, they have a membrane that lines them, right? Then the bone itself, bless you. Then the bone itself that is covering the organ also have a lining the bone itself. Now think about it, it's a smart way. God is very smart when he made those organs. This is it. Now, the organ is inside the bone. Then God put a lining.
Wait.
Now, there's a membrane. So this is a bone, right? Okay. Think about it, this is a bone.
Like your bone? Okay,
right?
Yes.
Then the bone has a lining, a membrane, protecting it, covering it.
Okay.
Then the organ is also inside the bone, right?
Yeah.
The organ also have a membrane protecting it. Why? So that even if anything happens, the organ is at least protected in a good way. Then there is a fluid here, which we call serous fluid. The space is not this big, okay? I'm just making it big to show you what I'm talking about. So there's a serous fluid there. Make sense? So the name of this membrane that covers the serous itself, you know the organ is serous, right? Every organ is a general name. The name of the membrane that covers the serous is called, that's what I want to put here. It's called viscera serous. Thank you. Viscera serous membrane. Oh, someone. No, this is not serous. This is viscera. I'm sorry.
What?
This is called viscera. All right. I'm sorry. I just took off what the person told me, but it's okay. It's part of learning. You can't forget that too again. This is called viscera. Every organ inside the cavity is called viscera, not serous. The membrane is what we call serous. Okay. So this is viscera. Oh, sorry, this is correct. This is going to be serous membrane.
Oh,
no, don't worry. Wait. It's the organ that is called viscera. I'm sorry about that.
I'm gonna stop writing pen.
No, it's okay. It's part of the learning. Just put it. Sorry about that. The organs are called viscera. Okay.
How long you been working here? First day? No, I'm just playing with you.
The organs is called viscera. The organs are called viscera. Then the membrane is what we call the serous membrane or the serous fluid. Does that make sense? Good. Sorry about that. Now, so the covering that covers, so this is going to be viscera, right? If you are putting the diagram too.
Sure.
The organs that covers the viscera is called the visceral serous membrane. And the one that covers the bone, that lines the bone, is called parietal serous membrane. Now, my clue for it is this. Now, anytime you are going out with your kid, where do you put your kid? No.
Oh, wait.
I know in the car seat, but if you are walking on the walkway where vehicles are driving, where do you put your child
On the outside.
on the other
You
side,
can always
right?
make more.
Right? Thank you. Then the parent will be on the exposed side. So think about it. Parietal is what is exposed. Exposed as outside. Viscera is what is inside. Make sense?
Yes.
But the clue is, before you say it, the clue is that the lining that covers the visceral organ is the visceral serous membrane. The lining that lines the bone, the cavity, is the parietal. But I'll be talking more about it as we go. We still have a lot.
Okay, and what is the difference between these two membranes, the one on the inside versus the one on the outside? What is their structural difference?
So the first difference is that this is lining the organ. Does that make sense?
Well, I understand one's on the outside.
And this is lining, no, not just outside and inside. This is lining, this is a layer on the organ.
Yeah.
This is a layer on the bone. So the one on the bone is going to be stronger membrane than the one on the organ.
Okay.
All right?
Okay.
Then in between them is serous fluid. Another thing they will be doing, even though they are there, is that they will also be secreting fluid, the fluid. Those membranes are also the ones that secrete the fluid. You are trying to see something. What's not clear?
Me?
Oh, no.
No, himself.
Oh.
Look like you are trying to see something I wrote.
I was taking notes. The serous membrane is what?
The serous membrane is this.
On the outside of the bone.
Everything is serous membrane. But there are two types of serous membrane. The visceral serous membrane, this is serous membrane, right? It is the membrane. But there are two types of serous membrane. Number one is this. The one covering the viscera, which is the organ. So this, we call it visceral serous membrane. And number two is the one lining the bone. And that is called parietal serous membrane. Does that make sense now?
Yes.
So the organ is called visceral, which was the mistake we made earlier. The organ is called a viscera. Every organ inside the cavity is a visceral organ.
Is that another spelling for it? I'm just wondering because it's
For which one?
visceral.
Viscera is this spelling. It doesn't. It's the same spelling
It's
everywhere.
not visceral.
Visceral. If it has L, maybe they are saying visceral organ.
I'm just
Then
asking, is it the same thing?
It's the same thing.
Okay.
If you say visceral organ, it means you are writing it as an adjective. It will have a L. If it is written as as visceral by itself, it won't have L.
Okay.
But I won't give you visceral and visceral, okay, on the test. If I'm saying visceral, it's visceral. If I'm saying visceral, it's not. All right. So what was I going to put here? So now, let me relate this concept. Did you get this concept?
Yeah.
Now, let me relate it to what we have here. It will make it sensible now. Now, when you say ventral body cavity, they have cavity behind, right? Ventral. What will we be talking about? Talking about the brain, the spinal cord, right? Those are the back, Then, thoracic cavity is your chest, right? The chest area. Then you have the pleural cavity that contains the right lung. You have the left pleural cavity that contains the left lung. You have the mediastinum that contains the trachea, esophagus, and major vessel. Then you have the pericardial cavity that is also around the mediastinum. Then that is that. Now, abdominal pelvic cavity is the other cavity you have, which is coupling the abdominal and the pelvic cavity together, right? Then the organs there are the digestive system and the digestive gland. Then the pelvic is where you have the reproductive organ. Now, I want to show you the cavities and the way they are named. I've talked about this. All of these are all description of this again, so I don't need to go through it again. Those are discussed here already. Yeah, so we are done technically. Now, let me explain this. I don't have a slide that shows what I want to show you here, but let me explain this here. Very important. Now, look at this. This is a pleural cavity. What is inside the pleural cavity?
The lungs.
The lungs. So that means the lung have a serous membrane too, right? Because the viscera in this cavity, what's the name of the viscera inside this cavity? The same thing I just asked. I'm just asking in another way. It's the lung. Viscera are organs inside the cavity, right? So if I say what's the name of the viscera inside the pleural cavity, it's the lung, right? Then it has serous membrane. Then a lung will have a serous membrane that lines the lung itself, which is what we'll be calling visceral serous membrane. Then the one that lines the bone, which is what we call parietal serous membrane. But now, since it is associated with the lung, and the lung is pleural cavity, we want to also see how we can put pleura around the serous membrane. All right? So we can call it pleural visceral serous membrane. Does that make sense? So when we get to the lung, we can say pleural visceral serous membrane. When we get to the pericardium, which is the heart, we can say pericardial serous membrane. Does that make sense? So if I want to differentiate between the serous membrane of the heart and also the lung, I can say pleural serous membrane. Then you know I'm talking about the lungs, right? When I say pericardial serous membrane, you know I'm talking about the heart. Does that make sense? Good. So that's all I want to explain there. Then I think I'm good to go. The regions and quadrants, and okay, this is what I've explained. So you can see parietal pleural membrane. So we are just saying this is the membrane that lines the bone structure of the pleural cavity, right? Good. Which is the outer membrane, and the viscera is the inner. All right, so that's it today.
Awesome.
I'm going to see you in the lab briefly. Okay, sorry, before we go, attendance. Thank you.
Yeah, how do we do
Now,
that
do
again?
are you comfortable with the check-in, or you just want me to call names?
Call names. Call names.
You prefer names?
Yeah, call names.
Okay.
No.
I thought check-in
Call names.
is easy, but I know some people have challenge because of the network.